Hello, everybody, and thank you, MSD, for inviting me here to present my case. First of all, Anne and Kim set up a very high threshold of graphic pictures. I do believe that my one are pretty much the same. So hopefully your postprandial time is not going to be affected by that. Secondly, the title of my presentation, Power of Vaccination, will be a different can of worms, probably few months back with COVID, but I was pretty courageous and I said, I will give it a go. Hopefully I wouldn't step on anybody's toes. So everything started with a phone call from a sheep and beef farmer. My calves are dying. And my first question, are they vaccinated for Clostridial disease? Yes, definitely. They got 2 vaccines of COVID-10. I said, okay, how many animals are we talking about? Oh, 5 calves died overnight and another 2 the previous night. I said, okay, I will see you soon. So basically, a bit of presentation. It's a not typical sheep and beef farm. Nothing spectacular there. They have some deer on the property. Rolling country, quite high up in the APT area. Supplement normal for sheep and beef. Important water was reticulated and some dams. Everything kind of started in February. The farmer got 2 lots of Rising 1 Speckle Park bulls arrived on the property from South Island. I'm not disconcerting any South Island farmers, but I think this is important in terms of probably epidemiology, even if I couldn't strictly relate it to that time. But so from that point on, everything was done normal on the farm, like regular drenching and weighing. In April, he had 2 calves dead, but he was not noticing us, so he kind of put it to the whatever happened. Basically, in 17th of July, he decided to do a drafting kind of procedure, and he drafted in the top and tail and mobs. He also used some rubber rings to castrate some bulls, and 2 calves were treated for scours. And soon after that, the hell started get loose. Now, obviously, I was called here when 5 cows were dead. I went there and I examined the moribund animals because there were some almost dying and the rest were okay. And based on that, I recommended vaccination with COVID-10. Obviously, the trend was still going, not as bad as previous ones, but and also I recommended the sick calves to be treated with Intrasil and LA, which is a double combination penicillin. I took samples for the post-mortem calves and I sent it to the lab, and the lab was asking me to go back and maybe euthanize a calf or find a moribund animal and do more testing. And basically, after I did that, on the 30th of July, there were no more deaths. So 7 days post-vaccination, no more no more death, but there were some sick animals still in the paddock. So mortality 23%, and it was pretty tough emotionally on the farm. So when I arrived on the farm, I would start asking the farmer all sorts of questions, if the animals had access to any toxins, if they were treated with anything in particular. And driving down towards the paddock, I had a bit of a bird view of the paddock and looked almost like war zone. And suddenly I had a chill down my spine and I said, shivers, this is anthrax. And probably my colleagues in MPI will have the same reaction. And obviously, we don't have anthrax in New Zealand. We had it until 1954, and it's a noticeable disease. We don't vaccinate for anthrax, and anthrax can kill humans. If you don't remember from our uni time, we definitely remember from the Power of the Dog movie. This is what I've got. So I started with some moribund animals. They were lethargic, down. Temperature, most of them, they had hypothermia because they already passed the septic stage and they were obviously dying. There were no nasal or anal discharge of any bloody fluids, so that gave me a bit of confidence that it's not anthrax. And also they had one or two legs, either front legs or back legs, that were swollen and puffy. So I was obviously geared up for a post-mortem, and my first idea was, yep, it is a Clostridial disease. So I opened up one calf after looking around it. Obviously, no blood through the nose or anus, and when I confirmed that the spleen was intact and not affected, I said, yeah, this is not anthrax. So I start doing a bit more courageous chopping. And soon after you remove the skin, you see those hemorrhage. They were not petechias, they were hemorrhage, and all the subcutaneous tissue were gelatinous in appearance. This is a front leg affected. This is not blood, this is necrotic muscle. So obviously I sent the samples to the lab. The initial diagnosis was, yep, we're dealing with black leg. Obviously animals were yarded not too long before and kind of fit the picture there. However, the lab said, it's looking more like malignant edema rather than back leg because it's more of the facial movement less than necrotizing myositis. I do believe that they are right based on what they saw histologically, but at the post-mortem examination, necrotizing myositis was the first thing that you will see. So further necropsies, go and sacrifice an animal and get a full range of fresh tissue and fixed tissue. So first of all, I try to find an idea what's the main difference between black leg and malignant edema. And obviously the agent is different, but most importantly, black leg is an endogenous disease. That means that the spores can still be in the muscle of a healthy animal, and when they find the hypoxic conditions, they will multiply, then they will create the disease, versus malignant edema needs an exogenous or an infected wound to start producing the disease. Black leg is mainly affecting muscle, and malignant edema subcutaneous tissue. So I organized with a farmer and to find a moribund animal, and for both our surprise, there were none. This is the animal that we decided to euthanize. It's healthy-ish, bright and alert. Unfortunately, you cannot see from the photo, but this big back leg all the way down is double the size of the other one. And if my little video works, it's a 5 out of 5 lameness. But apart of that, it was fine. It was eating okay and no clinical sign of disease. There were another 3 almost like him, but not as lame. So I euthanized this fella, and this is him a few minutes later on the bucket. This is the head, that's the sternum and the back legs there. A big hemorrhagic area right on the cranial abdomen, necrotizing fasciitis, but also deep section of the pectoral muscles show all the underlying muscles were affected. This is the back leg. Sorry, I will go back to try to guide you a bit. So this is the area that I'm looking for, the next one. So this is, again, subcutaneous tissue, very gelatinous, looks almost like strawberry jelly. But also here, very dark myositis, all this deep muscle. Surprisingly enough, if we remember correctly from our training with blackleg, you should find that rinsed smell. It was no smell. Any of the previous in this post-mortem case, no smell of the lesions. Again, probably slightly better picture. This is a very dark area of dying muscle. All that big gluteal muscle and everything done. Funny enough, all the abdominal organs look fine. No issues on the thoracic organs either. And further dissection, this is the back leg. This is the hock. There's the anterior part or cranial part of the metatarsal bone. All that underneath tissue was having that necrotizing fasciitis. So I start believing what the lab was telling me, because I see more necrotizing fasciitis, but I also see major changes in the deep muscles. So back to the lab with samples. Unfortunately, we couldn't still culture any Clostridial bugs. And Jeff from Gribos suggested that we may need further help, and MSD was very kind and helped us with further diagnosis, and we sent some samples to UC Davis in USA for some immunohistochemistry staining, and based on that report, we got the bull number 1, that was the initial post-mortem. It was malignant edema, and the second one was malignant edema and blackleg. So I would like to say thank you to Amanda and MSD and Jeff, Orbel, Francesco, and the farmer, and also thank you for listening to my presentation, and if you have any questions, please ask.